Happy Monday. Woo! Last Monday of January, I think. We're rolling. We are rolling into February next week, I believe, unless I'm out of my mind, which could happen. Today we have Odette Suiter. We love Odette. Odette's always a fan favorite. She is a wealth of knowledge, and she's had a practice that involved horses. Now, dogs, cats, horses, chiro, and holistic veterinarian. Now she does mostly online teaching, training, consultations, one-on-one, correct?
Not anymore.
She's just teaching. She's
Yeah,
wind down. So
yeah,
she is
yeah.
here to teach all of us proactive animal lovers how to get the best for our pets. Odette, keep going. Where are you from?
I'm currently living in the Chicago area.
And is that something that you want to change? Because you're like currently.
Yes, yes, I would like a warmer temperatures and like a beach or something like that.
Well, hopefully you'll come to California. Washington's beautiful. I spent the weekend on Vashon Island and it is gorgeous there, but too cold for me. Maybe in the summer.
Yeah. No, I mean in the summer it's nice here, but yeah, yeah.
Yeah.
Anyway, yeah, so I basically work with people in a group setting these days through my program, and I help coach them so that they can really understand what it takes to heal and how to really get their animals from an unhealthy state to a healthier state in the process. Because a lot of times these days we see animals that are really stuck in the chronic disease state, and getting them out of that has become a lot more difficult than it used to be. And so that's why I shifted gears a bit to really coaching people up close and personal, and and weekly, plus giving them a lot of knowledge and everything to really um, understand what it really is going to take to turn health around, and also kind of navigate the what I call internet vomit, because there's so much information out there, and it makes it really difficult to understand, or know which pieces are important and which are not as important, and to have a more organized sort of knowledge base, so that then the healing itself can be more organized and also accelerated. Because when it's disorganized, we kind of go back and forth between different things, and nothing is really moving the needle. And so I help support people in that process of moving that needle, and doing it as quickly as is possible for the individual animals.
I love that. And I love that you are a total out of the box thinker. I think you always have been. Like, I think you're kind of the person that always asked why and why and
Mhm.
why. And so the fact that you're passionate about poop, which thank you, because I think of you every time I go to an airport bathroom.
Yeah,
It,
I know.
it just ruins it for me. But
I keep
you,
forgetting my friend here.
your poop hat, the
There we go.
princess of poop.
Well, I
Yep.
washed it and it kind of got a little weird, lumpy.
Well, that's what happens when you
I
have
love
cleaner
that. That's
poop,
awesome.
right? If you clean your poop, it gets different.
It gets all
Changes.
lumpy, and I'm like trying to rearrange it, but it's just not like what it was.
You might need a new poop hat.
Yeah, but then you have the chemicals on it, so I'd want to wash it as well. So I don't know.
Baking soda, your crap.
Yeah,
Yeah.
yeah.
So you're seeing, I love that you were seeing like the the chronic autoimmune type of issues on the rise. I know we have like in the autoimmune family, we have like endocrine disruptions, endocrine system failures like Cushing's and Addison's, but there's a big combo regarding Plechner. And some people think that Plechner is not a real thing. Some people think that Plechner is a real thing. And I personally kind of think that it's a catch all that needs to be refined more and understood more. What are your thoughts on that? I'm going to hit you right off the bat. Let's do this.
Yeah, yeah. So can we maybe start? a little bit further back
Yeah.
first.
Yeah.
Start at
So
the
let's talk
beginning.
about autoimmune issues.
No, I want to go even further back.
Go wherever
Because
you
I
want.
think
I'm going to
I think
remove myself.
no, you don't have to remove yourself, but I think it's really important to kind of start at the beginning, because that way it makes it a little bit easier to understand. Because the thing is that well, we're learning a lot about disease, let's put it that way. And we are learning that there are actually a lot less diseases than we thought, because diseases, oftentimes, particularly the chronic ones, they really have the same metabolic process going on. So, for example, if we have an acute issue, like an acute injury, like let's say we cut ourselves, or the animal steps in a thorn, or something like that, there will be an acute response, right? First, we have inflammation, a little bit of infection to clean it all out. And then the cells are going to start to heal and regenerate and reorganize themselves. And then at the end, we have a healthy skin layer again, right? So everything is healed. So when we have chronic diseases, and that includes autoimmune, it includes allergies, I mean, you name it, anything that basically doesn't stop, or is recurs frequently, because it could also be like, recurrent diarrhea, for example. So things that recur frequently or are ongoing are considered chronic diseases. And what happens with the chronic disease is that healing process is never completed. So not unlike the skin, that where the healing process finishes, in chronic diseases, the healing process never finishes. So it gets stuck somewhere in the process. And unfortunately, the area where it's stuck is, I mean, there are different places, and it's a lot more complicated than how I'm explaining it, but I'm just trying to simplify it so that it makes sense, because I don't think we need to know all this complicated stuff. But basically, with chronic diseases, the disease process gets stuck somewhere, and it's usually stuck in the place where there's still a lot of inflammation going on, and these chemicals that are being released during inflammatory processes, or in the repair process, in an acute response, are basically killing things, are destroying cells, or eliminating cells that are not healthy. And so when it's stuck in that process, you can imagine there's just destruction going on, right? And so if that destruction never ends, then the animal's health is just going downhill, 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 and further downhill. So we don't want chronic inflammation going on. Because in the process of chronic inflammation, we also have mitochondria that are not working properly, because mitochondria, they have two functions. One function is to create energy, but when there's a danger, like an infection or allergies or whatever it may be, toxins, whatever it may be, we have, the mitochondria basically switch from energy mode more into surveillance and attack mode. So they actually start to release more ATP that then leaches out of the cells into the surroundings, and then the ATP in the surrounding areas then acts like a signaling molecule instead of like energy. So that's a little bit how chronic inflammation and chronic diseases happen. So chronic disease is not necessarily, it can be anything, but the underlying pathophysiology is very similar. And that's why we have to kind of get away a little bit from labeling everything. I mean, certainly it can help us explain, okay, so it's a little rheumatoid arthritis, so it's a little bit more in the joints, or it's allergies, we know it's in the skin, or it's, recurrent diarrhea, chronic diarrhea, it's more in the gut, but the process itself is very similar for all of them. And so then we have to figure, so the first question is always, why is it happening and how is it happening? So why, the triggers, and then what's happening, and then how do we bring it back from the process of, pathology? how do we heal? So we know we need to find out how did we get here, and then how do we heal? And so that's a little bit more of the newer research that I've seen happening, um, where we're just learning that there's more issues in bringing it back to the healing process. So there can be an acute thing, but then how, the body can get stuck bringing it back into health. Does that make sense?
It does. And I love that. It's very simple and clear. And a lot of animals are suffering from this. Is
Hmm.
it more now than ever before?
Yeah, yeah, yeah. And I think it's because I think nowadays we have a lot more triggers that are compounded. So maybe way back when we had a trigger of maybe kibble. When they started introducing kibble, it probably wasn't such a huge deal. I mean, I'm sure it was a problem. I mean, it was still wasn't healthy, but it wasn't the hugest deal, right? But then we added more on top of that, toxins, stress, vaccines, antibiotics, lifestyle changes.
Plantic stuff. Yeah.
Yeah, everything is basically compounded, and so it just added up more and more and more. And then on top of that, we also have generational pile up, basically, because whatever toxin an animal has now already came from the great great grandmother, so 4 generations back. So it
Wow.
takes 4 generations for toxins to not be present anymore. But because in each generation there's more pileup of toxins, it's just exponentially increasing the amount of toxins an animal or a human can basically have. And the same is true
I
for
didn't know that. I didn't know
Mhm.
the four generation de detox, I guess, but because we're not a cleaner environment,
Yeah.
I do hear that every generation is weaker and weaker instead
Yeah.
of stronger and stronger.
Yeah, exactly. And from a genetics perspective, it also goes 4 generations. And I'm talking about epigenetics, where it basically, certain toxins or situations, even stress can turn on or off certain genes. And so if a gene was turned on or off in great great grandmother, then the puppy will still have that same gene turned off.
Can we fix that?
Yeah, yeah, it can be fixed with, methylation, supporting methylation and those types of things. And then also removing the toxins that turned it on in the first place or turned it off. So it's on or off, certain genes are getting turned on, others turned off. So yeah, so that's a little bit, the basically the trigger of everything.
So when an unhealthy male and an unhealthy female, or they might look good, but under the hood they might not be good. Like something can be very
Mhm,
topical and superficial, like
mhm.
healthy looking, but we know because this group loves iridology, we look at the iris and we see some really messy irises.
Mhm.
And I always tell my students, don't look at the animal because they'll deceive you because you'll preform like, well, they look okay, but look at all these marks, and so when you combine two unhealthy parents, you're just gonna just procreate
Mhm.
more unhealthy puppies. It's nice that you can methylate that. And I've had an experience with that with my ex-husband. I had an ex-husband who was a smoker, but his mom was also not living the cleanest lifestyle, and all the boys in that family seemed to have some genetic methylation issues. And so I had put him on a super clean diet and detoxed him, and he was functioning high level. And then he just didn't want to do it anymore. And the nice thing with dogs and cats and horses is we are kind of their god. We
Mhm.
control everything they do, so we can really be proactive in this. How do you know what to do? Like, do you do testing?
Yeah, so I always start out obviously with getting a good history, getting medical records and then doing some additional testing to see, what toxins are they dealing with, what deficiencies are present, because I do see a lot of animals have some major deficiencies going on. For example, I had a little, puppy that somebody was bred her. I mean, she was a breeder, so she bred this little puppy, and we did a hair analysis on that puppy, and she was so deficient. I mean, she basically had almost no minerals in her system, and her aluminum level was sky high. And she wanted to breed that puppy. And I'm like, let's just wait a little bit. Let's just see if we can replenish her first and get some of that aluminum out of her system as well, because otherwise she's only going to pass it along to the next group, so they're going to have a lot of aluminum and they're going to be even more deficient. And so anyways, yeah, so some testing to see where they're at. So hair analysis is one of them. And then you mentioned Plechner syndrome. I certainly look at that as well, because I found that a lot of these animals that have these chronic diseases, they have adrenal deficiencies. Because when going back to the mitochondria, when they function properly, they make a lot of energy, right? But when there's a threat, when there's danger, then they go away from producing energy and they just spread their ATP elsewhere to, as signaling. And so then there's less energy available for the body. And that tends to also shut down some of the hormone receptors that are sitting on the cells of the body. And so when the hormones are not telling the cells, attaching to the receptors properly, or there's not enough hormones, then the cells just aren't working as well, because hormones are necessary to tell the cell what to do. If the cell doesn't get the message, they're like, well, no, I'm not doing it.
So Janet Rourke, Dr. Janet Rourke's asking you a couple questions on Facebook.
Okay.
Epigenetics is really fascinating to her. What are the most common deficiencies you are seeing, and what hair testing do you recommend?
Yeah, so the most common deficiencies that I find on hair analysis, and I use analytical research lab for the hair analyses, mostly because, well, it's a good lab. They don't wash the hair because you have to be careful what you use. There's some labs that will wash the hair, and then you don't really get the same results because it can wash out some of the nutrients out of the hair. Anyway, so I use ARL. And then the most common deficiencies I see is magnesium, calcium, and potassium.
Those are
Um,
pretty essential.
yeah, they're
Those
like three of
are
the
really
main.
for growth. Hello.
I
Oh
know.
my gosh.
And when they don't have enough magnesium and calcium, then they can't really control their energy, you know, their their nervous system and their muscles. So those would be animals that are hyper, even though they maybe have low energy, low adrenal function, low everything, they will be hyper. And I know what that feels like because I'm quite deficient myself. I'm working on it, but life. Um, but then I have a tendency of overcompensating for the deficiency. Like I go into hyperdrive and like jitteriness type of thing. So if you have a pet that is hyper, like a puppy that is like super crazy and super sensitive and sensitive to noise and sensitive to everything and just hyper and can't calm down, can't settle, then that would be a good indication that most likely they're very low in magnesium and calcium on the tissue
So
level. So those are that would not be blood level, because blood levels, they have to stay pretty even, but at the tissue level it can be quite depleted.
isn't that interesting because it is basically your electrolytes. So is the aluminum binding those things? Because I know aluminum and calcium have a love-hate relationship.
Well, I mean, aluminum does a lot of different things, including limiting the conversion of T4, which is the inactive form of thyroid hormone, to T3, which is the active form. Because the cells, the T3 attaches to the cells and basically tells the cell at what speed it needs to do all the chemical reactions. So it's like an oven, it's like turning up the oven, right? To bake the cake a little faster. So that's the T3. So it kind of decreases the conversion of that.
And so the aluminum, where do you think they're getting that? Is that from vaccines or is that from like bowls? Or I see it in the horses too. Every hair assessment I've ever seen in horses, and I haven't seen a lot because I'm always on the fence about it, is aluminum, high aluminum. And I've talked to other practitioners who do a lot of them, and they're like, that's the most common thing we see. So I thought it was like aluminum pipes for horses or shoes on them or their vaccines. What is this aluminum overload?
Yeah, I mean, aluminum can come from all sorts of different places. I mean, certainly vaccines could be one of them, but it's also in the environment, and they're also using it to spray for weather modification. So take your time. Yeah, so it's basically everywhere.
Yeah, I had to remove myself to blow my nose. Sorry
Yeah.
about that, you guys. Um,
No worries.
so weather modification, so the
Mm, yeah.
chemtrails.
Mm, yeah.
Yeah, interesting. And I noticed that I've had a lot of trees die around here, and my neighborhood has had kind of like an open discussion about it, and we wonder if it is the chemtrails, but nobody's running experiments on damage on ourselves and pets, right?
What do you mean? Like,
Like, is anybody actually running research on the potential for chemtrails? Like back in
oh,
the
well, I
early
mean, they're
days,
they're
we know.
barely acknowledging that they actually exist. So sure, I would think that some people may, but on the other hand, it's really hard to just say, okay, it's the chemtrails that did that, or it's this that did that, because we have so many different things now compounded that it makes it really difficult. We have EMFs, we have pollution from water, we have, obviously general air pollution, we have smoke, in certain areas where things are burning, stress. I mean, there's so many factors. So in the end, I think we just need to focus a little bit more on how we can reverse the disease process and focus less on what individual things are doing to the body. I mean, I think there's already quite a bit of research that's been done on how aluminum affects the body, how mercury affects the body, and things like that. But we have so many chemicals nowadays, and we don't know how even these chemicals interact with each other once they're in the system.
A
You know,
cocktail. Yeah,
yeah,
it
it's a
creates like
cocktail.
this
So, you
toxic
know,
toxic cocktail.
yeah.
So heavy metals must resonate, I would assume. I would assume like the 5G and the Wi-Fi,
Yeah,
that
yeah.
it would like reverberate through the animal conducting some energy. Is that true? I'm just
Yeah, I think,
assuming.
yeah, well, it's from what I've read and researched, the most toxic people tend to be the most sensitive people to EMFs.
And
There's not
allergies, right? Do they tend to be more allergic?
allergic to the EMF, you mean?
Or just in general, just they're
Oh,
sensitive all the way around?
yeah, yeah. Um, I mean, I don't know how many people have allergies per se. It seems like dogs tend to have a lot of skin allergies. That's one of the dominant things. When I look around with people, I don't know that I see a lot of people with allergies. I mean, certainly like in the spring, the hay fever or whatever people get, but it seems like a lot of people just have these chronic issues where it just kind of lays them flat, where they have no energy, they have joint pains, they have pains everywhere, they can't move, they can't, that's a little bit more of what I see with
Inf-
humans. So
inflammation.
yeah, just generalized inflammation. Sensitivities, what I see a lot, not just in humans though, is being reactive to everything. Like for some animals that I work with, yeah, you, yeah,
Yeah, that's why I was asking that. I
yeah,
was,
yeah, they're reactive
I'm
to
sensitive to,
everything.
yeah, I'm
Yeah,
sensitive to dairy and gluten
yeah,
and
yeah,
um, just
yeah,
molds and dust. And,
mhm,
I
yeah.
really have to watch
Hmm.
things.
Yeah, so if you're considering that an allergy, I mean, they would probably consider a bit of a mast cell activation thing these days. I'm sure there are other pathways as well. It's probably not just mast cells. I'm not, uh, immunology and that sort of thing is very, very complicated. So there's a lot to to learn, but just the reactivity, and I think it's just, yeah, for people, the more toxic they are, the more they react. But I think it's also the part where they get stuck in that cell danger response where things just can't heal. Like with long COVID is one of those as well. They're kind of stuck in that state where they can't heal.
And the body creates a fight against itself.
Yeah, exactly. It's trying to repair itself, but it never quite gets there. Um, so
And then a lot of people consider themselves on adrenal overload, and I'm always like, you guys think backwards. Like, adrenal overload is a side effect of something else. But I've had friends that were like, I was diagnosed with adrenal overload. I'm like, no, that's
what
a
does that even
reaction.
mean, overload? I mean, you mean adrenal fatigue, maybe?
Yeah,
Oh, okay, like just too much stress.
yeah. Well,
Okay.
I think there's more to it than that. So the endocrine system is so fascinating. And then we had a big discussion this weekend about fat being an endocrine organ.
Mhm.
And so we kind of all went down that rabbit hole too. So
Mm.
hormones, the body's a Rubik cube, and I always say rubric from homeopathy. So when one thing's off, everything has to compensate,
Mm.
it seems.
Yeah. Yeah, and I mean with hormones, it's obviously a lot very complex because first off, you can have the hormone glands not make enough hormones. Then you can have the cells not listening to the hormones because the cell receptors are blunted. And then you can also have hormones that are, structurally not quite right. So they also don't fit because it's like having a key that you're kind of trying to stick into a keyhole, but it just really doesn't fit. So nothing really happens, right? And then obviously you also have the interaction between the different hormone glands. So for example, if the adrenals are overworked and there's too much stress, then it will actually start to shut down the thyroid gland because it wants to get the body to rest, right? It wants it to recover. And then obviously in dogs and well, in dogs, not cats, but dogs, and well, humans, um, women in particular, once we remove the gonads of the dogs, the testicles and ovaries, and we women go into menopause, then we end up with high levels of luteinizing hormone, which then causes other issues, or adds to the whole inflammatory pathway that's already burning a little too hot. So
So I know we had Dr. Tobias on, and he did talk about hormone replacement therapy, but he felt like there was nothing really viable regarding females. Like he felt
yeah.
like there was a an injection that was really profound for his dog and
Mhm.
saw some amazing results, and it was really fun because the irises changed dramatically
Oh yeah, you
on
did some
that.
iridology on his dog.
He just threw up a photo of before and
Oh, okay.
after,
Yeah.
and it went from like black eyes to bright yellow eyes. I was like,
Oh.
Tobias, do you see that? Like I'm freaking
Mhm.
out over it.
Oh, that's
And he's
awesome.
all, I don't know what you're looking at.
Yeah.
Um, he's
Yeah.
such a nice guy,
Oh yeah,
but
yeah. Yeah.
but a lot of pet owners have female dogs that are just like, now what? And I've had a lot of people reach out to me after that live and go, what do I do about my female dog? I'm like, I don't
Yeah.
know. Let's have Odette on.
Yeah, well, I don't know either, to be honest, but I had a few conversations with Dr. Michelle Kutzler. She's the reproduction specialist, and she's the one who's done a lot of the research on luteinizing hormone. And she said that with females, you can give the supralorin, which is the injection that you're talking about, which is like a 6-month injection or implant, basically. And that should not cause a lot of adverse effects. Obviously, once you have a female that does have issues like urinary incontinence or other things that could potentially be related to hormone imbalances, then you can certainly also give a little bit of estrogen.
In
And
what form? Like, are we talking flaxseed or are we
well, no, it
talking?
would be actually a hormone replacement. God, I'm blanking on the name. Uh,
So maybe are we talking natural, like
oh, Incurine.
in
Sorry,
Keurig?
I was looking for the name of it. It's the Incurine, which is basically estriol. So that would be one option to give a female. But females also need testosterone. So some females would probably benefit from a little bit of testosterone as well, especially if they have issues, later on in life, like arthritis and things like that, aging. So there are people who are also doing testosterone therapy on
Wow.
female dogs. Um,
And could you do like antler velvet or turmeric or something that has a little testosterone naturally in it?
sure. I mean, all of these things can help, but is it enough to really change the whole hormone axis? Probably not. Plus, I mean, why not use the hormone if that's the one that's missing, right?
Right. I just always wonder about the long-term side effects if we're using like something targeted single chemical isolate. But maybe there's no problem. Maybe the quality of life is better and the degeneration of that animal doesn't degenerate. And we don't have that old dog syndrome that everybody likes to coin it as. And I hate that.
Yeah. I mean, I've seen a lot of dogs respond really well to hormone therapy, and I'm more familiar with the whole Plechner syndrome where they not don't make enough cortisol, and I've had a number of dogs where they basically came back to life, where they were itchy, hiding, not wanting to eat, acting like an old dog. You start to replace the hormones, replenish those, and they start to come back to life and, act years younger, no more itching, lose weight, whatever, or gain weight, whatever they need, kind of
Right.
help
Plechner,
regulate itself.
I thank you for that because Plechner seems to be like this weird catch-all where like dogs are too fat, test them for Plechner if the other endocrine issues aren't off the chart. And then they're too skinny, test them for Plechner. I'm like, what is it? Like,
Mhm.
is it, is it really like define Plechner? Because I feel like it's such a broad catch-all. Is there a way to define it?
So basically, with Plechner's syndrome, he calls it an atypical uh, cortisol estrogen imbalance syndrome. So there's an imbalance with cortisol and estrogen. So adrenal glands make cortisol, right? And when there's enough cortisol, the pituitary gland notices that because cortisol floats around in the blood. So it basically flows by the pituitary gland. The pituitary gland takes the measure and says, oh, yeah, there's enough cortisol. So I can stop producing a hormone or releasing a hormone that will stimulate the adrenal glands, right? It's like a thermostat, right? Once the temperature reaches the level it needs to, then the thermostat tells the heater to shut down, basically. But with Plechner syndrome, what happens is the adrenal glands don't make enough cortisol. And so then the pituitary gland will continuously release stimulating hormone that stimulates the adrenal glands to make more cortisol. But because the adrenal glands can't make more cortisol because it's, just not happening, we have this constant release going on. And this stimulating hormone, ACTH, also stimulates the part of the adrenal glands that also make estrogen, because the adrenal glands also make estrogen, progesterone, testosterone, aside from the cortisol, and then obviously the adrenaline,
Right.
and some other hormones as well. But basically what happens is it stimulates the part that also makes estrogen, and the estrogen level will go up in the dog. And what estrogen does is it basically limits the conversion of T4 to T3. So again, we don't have enough of the active T3 thyroid hormone. It also sits on the receptor sites at the cell level. So where the thyroid level is supposed to attach, we have now estrogen that's sitting there blocking the receptor.
Oh,
So
wow.
then, yeah. So then the cells at the periphery don't have the ability to really work properly because they're not getting the right signal. And then it will also decrease immunoglobulins, which is immunoglobulin A, G, and M. And lastly, it will excess estrogen will also cause immune dysregulation. And an immune dysregulation would be allergies, autoimmune diseases, cancer, etc. Okay. And so when we have Plechner's syndrome, we don't have enough of the cortisol to balance out the immune system, because the cortisol is a little bit like a brake on the immune system. Or you could, the analogy I've been using recently is, you have a child that's kind of going crazy, right? And that's because the parent is tired. So there's not enough cortisol. So if the parent is tired, the child is going to go haywire. If you have too much cortisol, you will have a parent that's too strong and will put a damper on the child, which we don't want either. So we want like a happy medium. So we don't want to have too much, but we also don't want to have too little. We need the exact right amount, right? And so that's what cortisol does, is it controls the immune system so that it doesn't overreact or underperform.
That's so crazy. So are you seeing that mostly in um, castrated, neutered, spayed dogs, or is it all dogs across the board? Like, is this
It
an
can be in
epidemic?
it can be in all dogs, but certainly more commonly in well, I mean, it would be hard to know because we have many more neutered, desexed animals than we have intact dogs. So I don't know that the numbers would be really representative, but I've certainly seen it in neutered intact animals as well. In fact, I
That's what
have
I
one.
heard. Heather O'Leary, Dr. Heather O'Leary, her dog was, I guess, on the cusp. Heather's watching right now, so
Oh, hi, Heather.
um, I know you have your
And
vet
Joan
friends
and
all
whoever
on
else is
the
here, and
yeah.
Julie.
Yeah, so she was suspicious that it wasn't really necessarily Cushing's, but there was an imbalance. And it's such a delicate thing to balance the chemistry. I would imagine most animals are out of balance.
Probably, but some are okay dealing with it. For some of them, we can manage it by just doing supportive things. But when they're really low and suffering, then I don't really hesitate to just put them on hormones so that they can get their life back. Because the problem is, if they are stuck in that inflammatory state that I talked about earlier, they're going downhill. So not getting them out of that inflammatory state is not helping. It's
Right.
only going
That
to
makes
it's going to damage their body longer. So we can look, and I've done that, with the allergy dogs that I used to get, like, years ago. I would try this, that, and the other, and nothing much would happen. And they were still suffering. Maybe they'd get a little bit better or whatever, but I'm like, why would I want to try for 2 years to try to get a dog better if I can get him better in like a couple of months, right?
Right.
Because then the body can actually heal, and then we can do things to really cleanse the body, replenish the body, do all these things. But when they're in a state of this chronic problem, they will react to everything. You can't move. It's like everything is slowed down. They're suffering. The person is suffering. They're living in a cone. I mean, it's just miserable,
So,
I
do
don't
you
think that's
see it
nice.
in horses?
I have not tested any horses, but I know that I think Plechner used to also check horses back then, but I never did, so I don't know. But I would think it should, it would just
I
be
think,
there as
yeah,
well.
I mean, we don't spay our mares very often, but we definitely geld the majority of
Yeah.
male horses. Dr. Heather is also saying that she's been giving her girl peptides in the AM, and is finally weaning her off of hydrocortisone. So she's having some positive effects
Mm. Yeah, I
to
mean,
it.
it always depends on how bad they are. I mean, I've had one patient, he was an intact Weimaraner. Well, he still is. He's not dead. He's actually doing really well, but he had some major issues, from very young age. And at one point, I tried to decrease his cortisol a little bit, and he completely
Crash.
yeah, he crashed. And it wasn't much, we decreased it like a tiny amount, and he crashed. So, you know,
So let's talk some crap. Um, there's hormones in fecal matter, and right? FMTs contain some hormones or no?
well, yeah, because some hormones are metabolized through the liver, and then the metabolites are are excreted um, through the poop.
So is there benefit to an FMT for Plechner dogs?
Yeah, yeah, but more because you're also increasing the integrity of the cell lining because you're getting microbes in there that make butyrate, more of it. So it increases the health of the gut lining. A lot of these microbes in the gut, they also are very good at eliminating toxins. So they process toxins. They send anti-inflammatory chemicals all over the place as well, good neurotransmitters to help calm the brain, which then also calms the whole system. So they have a huge influence on the immune system. Whether it's through hormones, I don't know. I know that they are doing some testing of cortisol, fecal cortisol. I'm not sure though if it's actual cortisol that they're measuring or if it's some kind of a metabolite. So I'm not sure about that. The other ones, estrogen, testosterone, and all of those, they would have already been broken down somewhat, in the liver processed, and they wouldn't be in the same form. Same with thyroid, probably. And then a lot of hormones, estrogen, progesterone, etc., they also get excreted through the urine, metabolized and then get out in the urine because that's how, they're able to do urine hormone testing for
So should we
humans.
be doing a urine fecal transplant or a urine transplant? There's this like
Well, I
human
mean, if
urine therapy kick where people are
yeah,
drinking urine.
yeah, but that's not a transplant. Well, I guess you could call it a transplant. When I think about a transplant, I think more about taking bacteria or microbes and putting them in there because there have been um, people who are doing urine transplants for dogs that have issues with the urinary bladder, for example, to kind of re-establish a good microbiome in the bladder. But yeah, there's urine therapy that you can use for all sorts of things. I've actually been using it for my eyes.
Is it working?
Well, last time I have a little bit of degeneration of my retina on the edges, so I've been putting a little bit of urine into my eyes every day,
Your
and it
your
was
own urine, right?
yeah, yeah, and it was already 25% improved last time I checked. That was about 5 months ago. I have to go back in February to recheck.
I'm excited and shocked and impressed all at the same time. I want to like jump out of my skin
Uh,
and ask you so many questions about this. I've never been brave enough to do urine therapy.
I
But
mean,
I
depending on the concentration of the urine, it does burn slightly.
okay. Drink a lot of water before you do urine therapy.
Yeah, but on the other hand, if it's a little bit more concentrated, then you also have more, of the goodies in there.
What else can you
Has
use that for? It's I
all
mean, I would
sorts of things. I mean, wounds, you can put it on, I mean, obviously drinking for rashes, you can use it. I think I mean, it's a type of therapeutic that's been used for thousands of years. I don't know the exact history of it, but apparently you can also leave it, kind of put it in a jar and then let it sit out in the sun for a couple of weeks, and then you multiply the stem cells that are in there. And then, but I don't know if I would want to drink that, to be honest, because
I'll let you do it first.
no, no, I think I'll pass. I was thinking about how about rectal insufflation? Maybe doing it rectally might be a better idea,
Yeah, maybe.
because then you can bypass the taste.
So, with like metabolic malfunctions, how important is gut health? Is gut like everybody says gut health is the immune system and everything focuses on gut health. Are all dogs with metabolic imbalances destroyed in the gut?
Well, a lot of them have imbalances for sure. I mean, the ones that I have tested, they're generally not balanced, and it generally also takes some time to rebalance them. But it's not just the gut, because if you have a body that's really toxic, then every day or every night, I should say, but daily during the day as well, but night more so, we have more toxins that are being dumped into the GI tract through the liver, through the bile, because the liver processes things, detoxes, changes the molecules into something else, puts them into the bile, and then the bile dumps it into the GI tract in the small intestine. And so, we also need to make sure that we can bind some of these toxins that are being dumped into the GI tract, because these toxins will also kill microbes. So they will also impair the gut microbiome. So we want to make sure that we get those out, because they can also be recycled if we don't get
Right.
them out. Like in a constipated cat, for example, they're recycling toxins all the time because they're not moving the, what did you call it? Crap.
The crap. So Heather's
So
asking, when will we have a Dutch DUTCH test for pets?
I have no idea.
And do you recommend a binder at night because of the toxin release?
Yeah, so with the Dutch test, I don't know if that's a test that they do just for women or if it's also being used for males. I don't know that. I would think so, because anyways, I don't know. But in any case, the female cycle from a female dog is very different than a human female cycle. So they have long periods where there's not much going on hormonally, and then they have some spikes of estrogen, and then eventually one of these spikes will then trigger the release of follicle stimulating hormone, um, according to Dr. Kutzler. So in any case, what I gained from that is that um, there's a lot of fluctuation happening, and it's not quite the same. So I don't know, even if you were to test it, how and when you would test it. I mean,
And
not
then
necessarily how, but when, what's the timing? What's the timeline?
and
So
I
I
know in the foals, because I used to be a breeding repro manager, we would always test their IgG with a snap test. And it was, just to make sure the foal got their colostrum. Wouldn't it be nice to have a snap test for all your IgG, IgA, and IgH?
well, I mean, it's blood too, so you still have to draw blood.
Okay.
Yeah, I
You
don't know
need
if there's
you need
such a
to have
thing.
a at-home test. You need to develop a
Well,
hormone.
yeah, yeah, sure. Well, yeah, I guess why not? But
Yeah.
I mean, there are labs who do that, and you have to do the blood draw anyways. So the only thing is, it has to be shipped to the lab, and then you have to wait until the lab is done testing it. Um,
Is there requirements on doing lab work like fasting or any sort of
It
concern?
depends. It depends on which you do. So, for example, with thyroid testing, if an animal is on thyroid hormone, you need to test it 4 to 6 hours after they had their pill.
Okay.
So that's important. Most everything else, obviously, if you wanted to, if you have a diabetic dog, maybe you'd want to do a fasting blood glucose just to see how far down they get, that type of thing. Certainly, if you have a dog, for example, that makes a lot of triglycerides, like the mini schnauzers, for example, those you'd want to fast longer, to just see, how far down can they get with their triglycerides. Um, yeah.
Interesting.
Yeah, and then
So,
just to go back to the binders, yeah, I usually would recommend doing binders in the evening. And I'm doing some trying out, but I don't have enough dogs that are throwing up on an empty stomach in the morning, because I'm wondering if these dogs just got really irritated by the toxins that are being dumped at night, because it's dumped right in the small intestine, the proximal part of it, so close to the stomach. So if that then is somehow causing disturbance in that area, so for the veterinarians out there, if you want to do some trial,
okay.
or anyone here who has a dog who throws up in the, first thing
Morning.
in the morning, if that's a part of it, I'm just curious, but I don't have anything to, back up my question yet.
Well, and I do know several dogs that don't like to eat first thing in the morning, and I always wondered about that.
Yeah, I mean, it's similar. It's just a different degree, like the ones that really throw up probably have worse degree of not feeling good. And those who don't want to eat probably are the lower level, but they still don't feel good. So
Do you want me to?
anything that doesn't want to eat in the morning.
Okay. Do you want me to send them your way?
No, not necessarily. They can just try some binders and then collect a little bit of information, see if it made a difference.
Okay. I love that. We
Yeah,
can
and the
do that.
binder I like is called True Carbon
True carbon cleanse.
Cleanse. Yeah, in all in one word. Let me see if I can't remember the company name now.
Heather's
Because that
saying,
one has it's True Cellular Formulas. So it has multiple binders in it, so different types. So it will bind multiple, many different things. So it will bind heavy metals, biotoxins, from mold, for example, things like that. Let me see if I can move this thing.
are
Yeah,
you,
so it has apple fiber, activated carbon, baobab fiber, fulvic acid, zeolite, clinoptilolite. And
okay.
it's a very clean one, because a lot of these binders, like zeolites and these types, carbon even, and others, they can have contaminants, and you don't want those in there. So it has to be a clean thing. And that one also contains a little bit of magnesium hydroxide, which is basically has a bit of a laxative effect, because you want things to get out. So if an animal gets a little bit of looser stool from it, then maybe back up a little bit, but it wouldn't be a big deal.
Well, and it makes sense because zeolite and clinoptilolite can have higher aluminum in it.
Right,
So
exactly. So you have to get, yeah. So those in general, the ones that I use are low in any of these heavy metals and things.
that's great. And also, I love apple pectin. I don't think we use it enough in the
Mhm.
pet space, even in the horse space.
Mhm.
Like it's a very common human product, but I don't think the holistic pet animal space has grabbed onto that.
Mhm.
And Heather's saying that's also cortisol imbalance, vitamin B depletion and probably zinc. You would think animals that are eating a raw diet would not be depleted in vitamin B. Are they?
Uh, well, I mean, you have to think about it. You have good diet, right? You have a crappy gut. What's going to happen with that good diet? It's going to go
Nothing.
shooting out the back, right?
Malabsorption. Yeah,
Exactly.
all
So,
supplements do not get absorbed.
no, and with food too. I mean, you can give a dog the best diet and you can have a lot of deficiencies because the gut is just not absorbing things properly. So that's certainly a part. And then the microbiome in the gut is supposed to make B vitamins as well. So if the gut microbiome is not optimal, then it will also make less.
I didn't know that.
Mhm,
That's so fascinating. It makes
mhm,
sense. It
mhm.
definitely makes sense. All right. So there's some people with some questions. Mary, you actually have a dog that used to throw up in the AM.
Yeah,
Do
my Francis was one of the worst IBD puppies I'd ever seen, and we used to do rescue. um, and anyway, he used to throw up the bile right in the morning. I worked with Dr. Kangas, actually, Dr. Odette, and she suggested I mean, where we started at the time was giving him a very small meal before he went to bed as well, just to get some food in his belly. And of course, we did targeted things. I did the FMT tablets with him, probiotics, very specific ones. And I mean, it's layers upon layers. Then we did some detox. So milk thistle really, really helped him. And then I just recently rounded out with a bentonite sort of binder. He's ferocious about eating in the morning now, but he used to be, even after we got the vomiting under control,
Mhm,
he wasn't a morning eater. It was like he just didn't want morning at all. He would take nighttime he would eat, but morning he
mhm,
didn't want it.
mhm. Well, that's
You
cool.
know what we did do for him? Actually, I just thought of this. Dr. Kangos, when he really wouldn't eat in the morning, I could feed him goat's milk. That would be his meal in the morning. He would do goat's milk because it was gentle enough, right? And it was also then allowed him to have something in his belly.
Mhm.
well, and
Cool.
restorative. The
Yeah.
Yeah, super helpful, right?
Mhm. Yeah, for some dogs, it also helps to just switch around their feeding schedule and make it really chaotic
oh,
or random because,
It is here because I have horses too. The dog gets fed when I can not be in the barn
yeah. Yeah, because in the wild, nobody, I mean, the rabbit is not showing up at 5 o'clock, like
on the
they have,
dot. Yeah,
they,
it
yeah,
builds
they
up
get food whenever if they find it. So
Isn't that a thing? If our animals start anticipating food too much, there is actually some acid change in the gut. Maybe that's with
they,
horses. I don't know.
they will just start making more acid in preparation for it. So
Yes.
it's like the Pavlov's reflex, right? You hit the bell and then they start salivating. So
So they
you hit
start
like
timing it.
4:30 in the morning,
Yeah.
the stomach is like, okay, I'm gonna have food soon, so I'm gonna start making more acid.
so it avoids that if you swap up your time frames?
Yeah, if you
hmm
completely switch it,
Yeah.
then
I mean,
the body never knows when it's coming. So,
I think I
and
learned that, and then dogs are much easier than horses that way, though, Poppy. With horses, I try to keep a window of an hour or so,
yeah,
but the
well,
dog,
horses have a very different
yes,
stomach acid production. They produce it all the time. So they don't stop. So they need to have food in their stomach all the time.
forage, yeah.
Yeah, yeah.
And
So
then, but they've done studies now with the horses to say if you feed at the same time every day, you're creating some problems in the body because they start to anticipate, right? And then the body starts producing, I don't know. So I've always tried to, my dogs and kitties never have had the luxury of being fed at the same time.
Right.
But the horses, I actually intentionally try to change it up by half hour, 45 minutes here and there. So at least it's somewhat different. They're mash meals, is I guess what I'm saying. They get hay 24/7.
And mine graze the majority of the day, but they like to come in at night. They have the option of staying out, but there's like coyote and mountain lion. So they personally come in themselves. So I feed them when they come in, but they always have food in front of them somehow, whether it's just, like grazing. My pastures are getting grazed down a lot this year because we haven't had much rain. Normally it's like almost like ankle high, but not this year. So hopefully we'll get more rain. No snow, though. I'm okay
Mhm.
with that. Very cool. Thank you for sharing, Mary. That was nice. Does anybody else have any questions? And Odette, if you want to add to your combo, please do. I didn't, so I think that's fascinating about the continual acid versus in horses versus dogs just are whenever they are ready to eat, when they think it's eating time. Do dogs tend to be too alkaline?
Well, no, with dogs, it just they basically produce acid when there's food, either it's
Yeah.
about to come, whereas horses they produce acid continuously.
Continuously.
Yeah,
And that's where
because
all
they're
the
grazing
ulcers.
animals. I mean, they eat 23 hours a day type of thing, right?
Right.
They're basically always nibbling on something, so they have this constant sort of acid production, and that's also why they don't have a gallbladder, if I remember correctly,
Mm-hmm. Mm-hmm.
because they don't have like a big fatty meal coming
That's
generally, unless you feed them a bunch of um,
Corn oil or
corn and
something,
yeah, things like that. But again, their digestive tract is adapted to what they would eat in nature. Um,
which is not meat fat.
no, and it's also small amounts at a time because comparatively, I mean, obviously they're bigger, they have a huge stomach, I mean, big stomach compared
Well,
to a dog.
their
You know,
stomach's small.
compared to body size, their stomach is small. Yeah, just like
Yeah,
Louise. So they
their
don't have a ton
cecum.
of room.
Yeah,
Yeah,
their cecum's
yeah, and the large
ginormous.
intestine is huge. Yeah, so their stomach is made to process little bits at a time, whereas a dog, they can have a huge expansion of their stomach because if they find some prey out there, they're going to eat the whole thing, and then they're like, and they're going to lay sleep it off somewhere.
Yeah, and I just talked to somebody about that, how dogs are capable of binging without harm,
Mm-hmm.
um, unless you
well,
have sensitive dogs that are gonna
mhm.
like bloat. But
Mm-hmm.
But
a
is for a
client,
healthy dog, isn't it? They're saying if you actually fast them every once in a while, it's good for their
Oh
digestion.
yeah, yeah, yeah,
Hmm.
definitely. Yeah, you don't want to do that with a horse though, but yeah,
No.
and not with a and not with cats either. So,
Hmm.
but dogs, yeah, definitely. I've had a couple of dogs where they had they had been stung by something and had a reaction, and had gone to the ER and got their Dex, prednisone, like steroid shot, and then they came off. The steroid shot kind of wore off, and then they had to continue with some Benadryl or some other antihistamine, and every time they would want to stop it, the rash or the allergy came right back. And so we tried some other things, quercetin, blah blah blah, the usual, and then it still didn't work. And so I
huh,
said, why don't we just fast? Why don't we do a reset on that immune system? So let's just fast a day or two, and that took care of it.
I love fasting. I use
Yeah.
fasting in my canine practice a
Hmm.
lot, especially like the chronic pancreatitis. And I think the pancreas, I don't know if anybody talks enough about gallbladder and pancreas because I do think dogs do get like super sludgy gallbladders, especially on a commercial, conventional type of diet. And that just makes everything more
Yeah.
sluggish.
Yeah.
Even in human medicine, we're not paying attention to the gallbladder, right? We just take it out. So there's something.
Yeah. Yeah, gallbladder is definitely important. And I just recently learned that apparently the gallbladder, the bile duct goes through the pancreas to then, open up into the small intestine. I didn't know that. I'm like,
So in iridology, they're right next to each other, the two marks.
yeah,
But
yeah, they're similar.
in cats, it's closer together than dogs. So I assume there's a little more air between.
Well, the dogs in dogs, you have the bile duct and the pancreatic duct. They don't join, but they basically kind
Oh,
of
they were
align.
side
Like
by side.
yeah, they're kind of parallel closer to this small, once they get to the small intestine. But if this is the bile duct, it goes through the pancreas, apparently. So if you have pancreatitis, meaning a swollen pancreas, it could potentially compress the duct a little bit and then make it so that things don't flow as well. But to be honest with you, I would want to see that. I'm not sure. I
Well, are you
personally
open
haven't.
to doing like a dissection class?
Like to, but no, not a class. But I mean, participating maybe, but not teaching it.
We're trying to find somebody for, because I partner with a bunch of dissection people for equine iridology, but I've not found anybody that would help us with canine iridology. So we take the photos of the animals prior to euthanization and assess the eye, then they dissect and we compare notes, and it's been pretty profound. But dogs, nobody wants to do that with dogs. Yeah,
Yeah.
but it would be
But anyway,
fascinating.
yeah. And then going back to cats. So the cat's bile duct and pancreatic duct, they join and
Oh,
then they open up together, like as one. So they join together and then they open. Basically, that one connected duct then opens up into the
so you're just
small
proving
intestine.
iridology is so accurate right there. Because on cats, they're like this, the markers, and on dogs, the markers are like this.
Yeah, well, the dogs, they can also have a second pancreatic duct.
What?
I think it's called the accessory pancreatic duct. It opens
Mm.
up. I mean, just Google it and you can see the anatomy of it. Um, but anyways,
So
so
I notice a lot of anatomical structures on Google are off. Like,
yeah, well, I mean, you have to obviously be discerning of
yeah.
what it is that yeah. Certainly don't ask Chat GPT. I don't know.
Yeah.
Can you make me a drawing of the pancreas and then it makes some sort of a weird thing with a skeleton attached to the pancreas or
I've tried
something
and it's a
weird?
mess. I'm like, that's not a spleen. That's not what that is.
No, no. It comes up with all sorts of weird things.
So, how proactive are you about protecting or detoxing the gallbladder?
Well, I mean, it's part of the drainage pathway. So when you're detoxing, you have to do it correctly. Okay. So you have to have a binder in place to really pull things out and bind things. And then you have to start to make sure that you're actually opening up the drainage pathways. And that's supporting the bile flow, supporting the liver, supporting the kidneys, supporting the lymph system. And then at the same time, you also want to obviously support the cells because when you detox, prior to even detoxing, you have to make sure that the cells have enough energy because, and that goes for all the cells of the body, but especially also for the liver cells, for example, because if you're starting to detox and the liver cells have no energy because they're burdened by too much toxicity themselves, then you only make it worse. Then you're mobilizing things. And those are then the animals where, you start something and they get worse with what you're doing. So you want to, the preparation phase of it is really to improve the energy of the cells. So you're
Okay.
improving the function, including you're improving the structure of the membranes, you're improving the energy, the amount of energy that they can produce. You're improving methylation so that the production of proteins and everything else that the genes do is more appropriate. And then you also want to obviously remove any toxins that you can, obviously make sure you're not giving more toxins. So remove that. That's cleaning up the environment basically as much as possible. And then you also want to provide some anti-inflammatory support to help to decrease the inflammation of the cells. Because when cells are inflamed, the cell membranes are inflamed, and then the receptors on the cell membranes aren't working properly. So nutrients can't get in, waste can't get out. So first you have to support the cell to function a little bit better. And then once the cell functions better, then you work more on actually detoxing. That's when you then give binder things to kind of stimulate the release of toxins from the cells, but then you also have extra binders that go into the body, not just into the gut, because the binder that I mentioned earlier, that's just one that stays in the gut. It doesn't really go very far. So then you want to have systemic binders as well to help.
Talk to me about systemic binders, because we definitely see systemic toxicity in the iris. I usually use a humic fulvic product and it seems to do a good job, but I also like DMG and NAC and MSM, but I don't know if that's enough.
Yeah, so binder, I mean, for binder wise, I mean, what you want to do when you're working on the cellular detox, so body, it's called the body phase from, from the person I learned it from, calls it the body phase, where it's basically taking more of the superficial toxins out of the system. So what you want to do is you want to improve the amount of, or increase the amount of glutathione in the cells, because that's a master antioxidant. So you want to give something that helps to increase the production of glutathione in the body. And
So
then
would you go with NAC on that?
yeah, some alpha lipoic acid can be helpful, although you have to be a
Okay.
little careful with the amount that you give, because cats can be really sensitive to that. So there's a limit. Yeah, NAC, broccoli sprouts is in one of these products, turmeric,
I
milk
love that.
thistle, cardamom, melon fruit extract, and then a bunch of mushrooms, fermented mushrooms.
Oh, that makes
And
sense.
mushrooms, at least the formula I'm using has mushrooms that are grown on turmeric and on ginger. So
How
they also
cool.
take in the nutrient, the compounds from ginger and turmeric.
Okay,
So
stop the train. My mind
What
is
is this
blown.
product?
I know,
Yeah,
we're
I
all
know.
like,
Hang
what?
on, because oats is like the one that you get everywhere, and I have a horse allergic to. What is this product, Dr. Odette?
So I'm a little hesitant to mention the name of it, because it
Okay,
really has to be done properly. And this company doesn't actually sell to the public unless you
Okay,
have a
so we,
practitioner helping. So
got it.
because it has what I have found, because I've been using them for my patients, they can, I mean, you have to have someone help in the process, because, for example, I have one dog, he started to get crazy itchy from it. So we had to adjust things. So she needed my help to adjust that, so that, we added more binders. We decreased some of the other supplements a little bit, because it was just accelerating things too much for what his body could handle. So I'm a little hesitant to just blurt it
That's
out, because
fair.
I don't want to, mess anyone's animals
well,
up that
we'll
way.
just send them all to you.
Yeah,
Okay.
I'm happy
Mm-hmm.
to help, and
And then
such.
if you
But
know of an equine also, that's
Yes.
yeah, I
the
mean,
trouble.
these
Yeah.
are human products, so
So
I
you
don't
could
know how much you would.
theoretically, yeah.
Yeah, I mean, you may have to use a whole bottle for a horse. I don't know,
Yeah.
but for horses, a company that I've very much enjoyed working with. Well, no, I didn't really enjoy working with them, because they were a pain in the ass. Pardon my French, but their products were really amazing. So they have a really amazing feed that is high in protein, higher in fats, and very low in carbohydrates. And then they have a whole detox system that kind of goes with it.
Who's that?
They're called Equine Feed. I think they used to be called Vita Royale.
Okay.
Oh, I think I know
Um,
that company. Yeah.
yeah,
They
but
are a pain because you can
yeah,
never get a hold of anyone.
they're a complete pain to deal with. It's so sad, because they have an amazing line. But because one time when I was still working with horses in Aiken, I walked into a barn and I'm like, wow, these horses all have like an amazing top line and they look amazing. And so I asked the woman, the owner, well, what are you feeding? And she said, oh, you wouldn't know it. It's just a small company from somewhere in South Dakota. And I'm like, well, who is it? And she said, oh, it's Vita Royale. I'm like, I kind of knew it.
Yeah.
That's so
So
amazing.
you could see it, I mean, it was obvious, because most of the other barns I used to go to, I mean, the horses did not look healthy, you know.
Right. Right. Heather's saying, what about the phototherapy patch? So she's into the LifeWave patches, and that does stimulate glutathione. So that might work too.
Yeah, that would certainly be helpful. Yeah, and
It's
they've
worth
come
a
up
try.
with a lot of things. I mean, there's so many ways. I mean, there's so many ways to roam or whatever. It's like,
It's fun.
yeah, it's fun. You just have to
That's what
find
this
your own
membership's
thing.
yeah,
Hmm.
this membership's about just exploring all your options. And it's
Hmm.
been going on for like 6 years now, and we haven't quit because
Wow.
there's more options. Yeah,
Yeah,
it
but
just
it's helpful to have a good strategy. So, just have a plan, because what I see a lot is people not having a plan. They're just doing random things, just thrown together because they heard that's going to work better than whatever, or worked for
right.
someone, and then they try it. And then I ask them, well, have you seen a difference? And they're like, well, I don't really know. And then, so I'm like, well, let's just stop it then and see what happens.
Right.
So,
And then there's the proactive pet parent that throws the kitchen
yeah.
sink and the chicken
Well,
at them.
mhm,
So then you're just like, that's just so much stuff.
mhm,
Like let's back the train up a little
yeah,
bit.
yeah,
Susan
because I'm,
Fletcher
go ahead.
Susan Fletcher Scott is asking, how can she work with you?
Well, I do have a master class that you can watch. Start with that, and then once you've watched that, you'll have the option to schedule a assessment call with me, and there will be a questionnaire to fill out, and then we'll have a chat, and then I'll talk to you more about what the program is and all of that as well. Give you the strategy and what's going to be necessary to help your animal, and then if you feel like it's the right path, then we can work together.
Awesome. And where's that link for the master class?
It's on my website. Yeah,
Okay, I'll
thank
grab
you.
that
Thank you,
for
Mary.
them and I'll put it on the live stream. And Peter Shankarelli is just joined us. He wanted to know what the topic is, and we're talking about chronic illness, metabolic imbalances. So
Mhm.
kind of your favorite thing, Peter.
Right.
I
Yeah.
just tossed Dr. Odette's link in the Zoom
Yeah,
for you,
thank you.
Poppy. So just on the Facebook needs it. But I just want to honor that you didn't share that product with us, Odette. I actually think I did it backwards for my horse, the detox thing. And I think, Poppy, that's part of what I'm unwinding still.
Mhm.
I did it the right way with my dog. And you just talking through it validates that for me, because we did building of organ health before we detoxed. Yeah. And with the dog, but not so much the horse. So it's interesting.
Yeah.
Strengthen and support so the detox is not so
Yeah. The good
hard.
news with the dog was he wouldn't have dealt with detox. I couldn't detox him because he was having such reaction to anything too much, where horses are too darn stoic, aren't they? Yeah.
The eye
Yeah.
doesn't lie, though.
Yeah. Yeah. And there's so many animals that are so sensitive right now. And same with people, at least the ones that I work with. Some of them, they can't even put like a grain of something into their pet's food without creating like a major reaction. Even like a little,
Yeah.
like not even a,
Oh, I
a
know. That
molecule.
was that was the
So
puppy I was
it's
talking
hard.
about.
Yeah.
Yeah. And I
So,
was told by a specialist he might need to live on steroids his whole life. He had such bad IBD. Well, we fixed him. He's a healthy dude now, but
mhm,
it took a solid year of
mhm,
layers.
mhm. Yeah.
And
Yeah.
Peter just asked, do you know why it takes 4 to 6 weeks to get the Plechner test back? He was wondering if there's that many people actually testing for Plechner.
I usually get it back in like 2 weeks or something, because they run the tests on the weekends. And so if you send it in before the weekend, you should get it midweek after.
So
So
send
it
it
doesn't
in
take,
by Friday?
yeah, if they have it by Friday, then usually you get the results by Thursday.
Okay, good. And
So it doesn't take that long. But sometimes they're a little behind or something. Because it's a one-man show, that lab, I think. So if he's sick or whatever, then he's just saving the samples for the next weekend or something, so it does happen.
He says thank you.
Mm.
Right on. Peter, you should have joined us on the Zoom. You would have been
Yeah,
a great
it would have been nice to
contributor.
see more people on Zoom here,
I know, it's
see
always
all the
fun.
faces, but thank you for those who showed up on Zoom and otherwise too, obviously. But it's always fun to see people. Oh, thanks, Julie, for finally turning on your camera.
You guys, any other questions
I
before we
actually
say
thought it was
goodnight?
on.
It's okay. I like the picture though of your dog.
My little baby. Somebody did that for me, a caricature.
Yeah,
Aw.
it's cute.
I have a question about the Plechner test since Peter brought it up. So, unless you do the Plechner test, you don't know if you have all, the cortisol, the estrogen, the IgA, etc., all off. How many dogs really do have that and just didn't get the test, like what I'm going through? Like what I have with Gigi is probably 75% of the dogs out there probably have something similar. But unless they don't do the test, they have no idea that it's Plechner because a lot of the vets don't even know Plechner exists. So, I mean, my take is that most of the dogs out there probably have some version of it.
Yeah. And cats too.
Yeah.
Oh,
And humans probably. And
I have to
horses.
say the Chinese herbs are working. Her hair's getting even longer.
Yeah.
Poppy, she's getting better.
yay. I'm so excited.
Me too.
So yes, Plechner, I think, is kind of a confusing aspect, but I do like cats after they get desexed, they seem to get like poochy and gross and like lethargic, and I hate that. So how many people actually test their cats for Plechner?
I don't know. I mean, I do. I have a few that I've tested. The most recent ones were two cats with recurrent urinary tract issues.
Oh,
So that took care of that, and
it
they
fixed it.
came out of hiding and were more active and more alive. I think one of them was always kind of sort of at the brink of being euthanized, because she also had some other issues, and so she's doing quite well right now.
Poppy,
That
the
is
question is how many people in general, dogs, cats, whatever, do the test?
Oh, I don't know.
Yeah,
That
I
would be
mean,
a
like not
question for the
men.
lab. I
Yeah,
don't know
no,
that.
but I mean, I'm just saying to Poppy, it's something that most people don't even know exists.
right. Yeah, it's a foreign word to the average pet owner.
And
So
many vets too.
Mhm.
It's scary how many vets have no clue.
Yeah, yeah. But we're changing that one pet at a time.
I
Including
love
mine.
that. I'm so thrilled to hear that cat's UTIs and chronic urinary issues
Mhm.
resolved. Like, oh my gosh, that's mind blowing.
And then, cats who constantly overgroom themselves as well and get stressed out about everything. Those are generally also candidates. I had one that had recurrent pancreatitis, like real pancreatitis, where he just ended up in the hospital, because of like an acute flare. He did really well for the rest of his life on a little bit of hormone therapy.
That's pretty amazing. It
Yeah,
makes sense. It totally makes sense.
yeah, yeah.
Yeah.
And it's an elegant way of helping an animal, because and a fast way, and one where you don't have to do a whole lot of other things. I mean, you can always help to improve the body and all of that, but it's something that can also give you a little bit of faster results.
It
And
feels like most people are just putting their finger in a hole and trying to block the damage. And the nice thing about this approach is you're getting to the root cause and the whole
Mhm.
system failure.
Mhm. Yeah, because once the hormones are in place, the whole body can start to work better because the hormones are signaling the body what it needs to do.
Yeah.
I mean, it's
Are
kind of
they
like
treating,
sorry.
are humans being treated for this too?
Yeah, I think you can also send it into the same lab, right, the human sample. I actually did that years ago. And yeah, I was a little Plechner's myself too.
You were?
Yeah,
Did
I should
you?
probably retest now. It would be
That's
interesting to see.
Now that you put urine in your eye,
Yeah, right.
you changed your hormone.
You
Your
know, you could
hormone.
put red light in your eye and it'll help too. It might be better if it's the right
Well,
device.
yeah, yeah.
Janice, Debbie, any questions?
No, I just thoroughly enjoyed this conversation. There's so much information out there. And, when we talk about hormones, I feel like we've barely touched the surface. I feel like there's so much more information. We'll know eventually how hormones actually work together with, neurotransmitters and everything else in a much more detailed way without, I feel like now we're guessing. And I think that's why a lot of you run into physicians and vets who don't acknowledge some issues because it's not well defined enough for them to acknowledge it. Like I have MTHFR, and there are doctors out there who don't acknowledge it at all. And then there are the specialists, the functional medicine physicians who actually take care of that because that's their specialty. I think I don't know, I get very frustrated about this, but I feel like the more information we know, that the practitioners themselves, the vets and the not just the researchers need to do their job, and then the vets and the um the physicians who actually take care of patients are the ones that need to put it together for everybody. Because it needs to be understandable and it needs to all be brought together instead of separated out into specialties that
That
don't talk to
drives.
each other.
Yeah.
That's where we lose it, is that people become so specialized that you don't ever get that information.
Well,
And
and
and, and it,
nobody treats the body as a whole.
right. And it's not because they don't want to, it's because it's such a complex system that
Mm.
you can't always put things together properly so that people understand it. But I think it's just going to take, I think we're just at the beginning, especially with the nervous system. I don't think we know. We've had this conversation in with past speakers before. We don't even know the extent of what our bodies can do yet, or the interfaces that we have with the environment around us and the space around us, and how we respond to those things. So, it's going to take a while, and there needs to be a way that we can put a process in the middle of all of our work to have people integrate all of the information together. As the information comes up, the people who actually deal with the patients are the ones that really need to put all of the information together so that we can all understand it better. That
I
makes
mean,
sense?
it's happening. There's more and more people, doctors who actually offer programs just like I do, and mine is kind of, a mirror, or like it's not like I came up with it on my own.
Yeah.
But there are more and more functional medicine doctors who do offer that, where
Yes.
they offer training for the patient to really help them understand better and such, and then help them along the way,
Yeah,
coach them.
I love that. I think that's wonderful.
Mhm.
For the MTHFR, I don't go to the doctor about it because there's nobody near me. So I go to the internet, and there are groups on the internet from people who have the issue, who people who are working with it from a genetic standpoint or a biologic standpoint or an electrical standpoint, and they're the ones that are coming up with the information, and then somebody just has to put it all together. Won't be me.
Yeah, but again, it already exists, is what I'm
Yeah.
saying. Yeah,
Yes.
yeah,
Yeah.
there are people already who have already put it together to
Oh, good.
teach it. Yeah. There are programs that, as a patient, you can go join, and then they basically guide you through the process of it. Because it's difficult, there are so many different components that play a role. What's going on in the mouth? Are there any hidden infections somewhere? Are you getting exposures from work? Are you living in a moldy house? Things like that. So there are a lot of different components that play a role, that can contribute to, the big trigger, and then, starting to kind of peel away these layers, and supporting the body and becoming healthier and healthier.
Well, Odette, I'm going to send some clients your way.
Thank you.
Yeah, my pleasure. These are very
And I'll
frustrated
say that
vets.
her course is great, guys, if you want to sign up for it. You'll learn so much, and she offers so whoa, I'm getting attacked. Offered so much. It's well worth every penny.
That was two
Well,
paws
thank you,
up
Julie.
on that.
I know, exactly. Except she's not the patient.
Paws up.
She's the assistant patient.
Yeah.
Okay. Right
Well,
on. Odette, thank you for your time. And I know
oh,
it was
you're
kind of
welcome.
a little jumbly on scheduling, but thank you for being
Mhm.
here with us. We really
Yeah, no, it
appreciate
was a
it.
pleasure. It's always a pleasure to talk to people and hear what their stories and all of that. So I enjoy that. And I always say that I'm just one veterinarian who's spreading a bit of information, but you as the pet parents are the ones who are then using it, utilizing it, and spreading the word and changing the veterinary field with what you're asking your vets to do, and you're changing the field of nutrition. You're basically changing the field of medicine. So it's always the people who are making the difference.
So, you guys, it's up to us to open our mouths and spread the word and give hope to those dogs and cats that are near death with no answers. There's answers. We just have to look in a different way. So,
I
yes.
will say, coming after 4 full days at VMX, which is the veterinary conference, it was amazing how many, mostly students and a lot of vet tech nurses who really, really want to get into natural and holistic. We were lucky we had Judy Morgan at the booth for 3 full days, and
Oh,
she
nice.
spoke to each one of them.
Mm.
And, we were with Jibs for Dog, and he's very much an advocate for natural and healthy things. And it was really, really amazing how many of the students want to do it. Judy's thinking of going, she's working with the AVMA girls about going to all the schools and doing speeches or talks
Cool.
about it. So
Mm.
definitely made some headways, and I was working with the AVMA people with some ideas how they could get the word out more. So I think
Mhm.
things are going to turn around soon, or there's
Yeah, it's in
turning.
the process. It's happening. Yeah, but
But it
thank
was
you for
amazing.
contributing to that, Julie.
Yeah, I mean, it was amazing
Mhm.
how many students were just like, "Oh wow, I never did this. This is great." Or I'm learning this, but I don't know how to do it. Or how do I bring it back to my vet to get them to understand if it was a vet tech or a nurse? It was
Mhm.
pretty positive.
Yeah, that's awesome. That's
That
awesome. Well, I
is.
mean, veterinarians are realizing too that they're seeing the same things over and over again and they can't help them, so they're frustrated. I mean, some of the vets that I've talked to, they say, "Oh, I'm glad you're on board with part of the team," because they're frustrated. They're like, I mean, I would be
Right.
frustrated if I couldn't get these animals to heal. I mean, that's just not fun.
Yeah, the pill for every ill is failing.
Yeah, it is.
Suppression is not good medicine.
No, I mean it's what we learn in vet school, that's what we learn, but it used to work because we used to have more acute diseases. We didn't used to have all these chronic things going on, but now that we have all these chronic diseases, we have to adjust and learn and adapt to it. I mean, even in the last 5 years since COVID, it's been different, the level of chronicity and severity has increased significantly since then. So
Yeah.
what used to work 5 years ago doesn't work anymore, or at least not the same way.
So
So,
many of the vets too are just like, for lack of better words, like money hungry. My neighbor's dog cut her foot, just a little cut, little dog, sedated, Gabby, and a whole bunch of drama around a little cut. I mean, it was just ridiculous. And I was like, why are you doing that? Just rinse it and wrap it. It's nothing major.
Well, I'm always very protective, and my colleague, if you're not there, it's hard to know, and it's very positive. We, as veterinarians, we also obviously have to listen to our clients.
Mhm.
So if I have someone who comes into my practice and is freaking out because of a urinary tract infection or something simple that we could just maybe let it run its course, I will also give something, because I know that if I don't, I'm going to be sued. because I didn't do whatever I
Right.
supposed to do. And you don't know how deep the cut was, where it was, if they needed to really look at it better, and if the dog was wiggly, whatever may have been the case, you know. So I have to say that when people say that the veterinarians are only after money, that kind of gets my shackles up a little bit.
Well,
And
and I,
Well,
because
she's a
I see
nurse.
the inside of, you know, I have inside, I've walked in those shoes.
And I
I'm
get
still
that
walking in the shoes. So
I totally get that. And she's a nurse, and she even said it's nothing. And she's like, I told her I didn't want Gabby. She said, well, maybe I should. And she went and did the GABA. So I just,
yeah.
well,
Yeah.
and you guys, vets have a tremendous overhead. They
Yeah.
have
oh, yeah.
staff, they have equipment, they have
Mhm.
insurance. Like pet
Mhm.
health coaches come into this with zero, like their course and their computer.
Right.
And so I am pro go vet because I've had some vets die and they
Mhm.
died from the immense pressure. And so it is, I know veterinarian girlfriends of mine that didn't pay off their vet scholarship stuff, their vet loans until they're 40 years old. That is,
I have people who are 50 and still haven't paid it off or haven't barely made a dent.
I feel like again, this is something though, it's MDs and DMs. It's needs some more support from your systems. You know, the AAP, the AMA, the veterinary associations need to be there, not just to regulate the practitioners, but to provide support and organizations so that they don't have to feel that way, that they're not out there on their own, you know, and give them better ways to do things and consolidate things so it's less expensive, so they don't have to worry about that. I think the entire systems need to change because it's not working the way it is now, and we are making people sicker, and that's getting us into more trouble. And it's getting practitioners into more trouble because it's making it more expensive. So it's like it's a vicious cycle. I feel like there needs to be a major upheaval of some kind, and then people would start thinking differently and maybe looking to each other to coordinate things and support each other in a different way.
Yeah, it's actually getting started. I mean, it's slow to start, but there's now a whole field for veterinary social work. And um, I went through the program, and so it's like a lot of colleges are starting to offer it now, where you can get a certification and you build upon that social work practice, where you go in and actually work with veterinarians because they have one of the highest suicide rates of any profession. And so there's a lot of talk about that in the veterinary social work field, going in there, supporting them, and the pressures on them is just unreal. And so, yeah, you're right, Janice. And like I said, it's starting. Unfortunately, it's slow and it's going to take some time, but at least we have a start.
yeah, I just feel like school loans should be wiped clean. I don't know.
Well, I mean, in
It just,
Switzerland or in Europe, we don't have any tuition like that. I mean, I think I paid maybe $600 of tuition or $300 tuition per semester, and then we had maybe a few $100s for books and the final exams at the end of the year, and that was it. You know,
That's
the rest is
awesome.
paid through taxes, and it should be the same in the US. I mean, when I first came here, I'm like, oh my God, this is insane. These students, and not just the vet field, everywhere, they should not have a mountain of debt to
go to
carry
college.
around their entire life. I mean,
I think
that's
it's really
insane, you
dumbed
know.
down our
Yeah.
society. I think it's really been detrimental. My nephews actually went to school in Scotland
Mhm.
because it was half as much money, twice as fast as the American college system, and they were very employable when they got out of school.
Mhm. Mhm.
Yeah,
Yeah. Well, I think kids should be getting the support they need to get through school and then
absolutely.
have the freedom to, really do what they want and not be burdened by a mountain of debt.
And I think that detracts a ton of people from being vets is you're going to go to vet school, you're going to pay a fortune, and then you're going to work for the rest of your life on a high powered, high stressed job that is incredibly demanding. And it's just, why?
Yeah, and then you have people who tell you you're just after the money. Sorry,
I
truly.
don't mean there are others who
No,
are.
but I mean,
But
I hear that all the time, and it drives me insane because I do not know any vet who is after only in it for the money. Because if you're only in it for the money, you
Get
would
out.
find another job. You wouldn't be a
Yeah.
veterinarian, because let me tell you, being a vet comes with a lot of stress, a lot of pressure, and you know, as you mentioned, Charlene, you know, there's like a whole lot of social work starting to happen because of it. But no veterinarian goes into becoming a vet because of the money, and they do not stay in the field because of the money either.
Yeah.
I mean, I just don't believe it. You know, probably 95% of all veterinarians are hypersensitive. That's why they end up committing suicide, you know, because there was just one too many people who told them, oh, you're just in for the money, and yelled at them for whatever, blamed them and made them wrong, you know. And again, I know it's also, there's also the other side of having the client, you know, the client feeling pressure to do things and all of that. So there's that as well. So
Well, and
it's just
corporate.
it's just not simple, and we cannot put blanket statements on.
Well, and I also feel,
Yeah.
that when you've got that much pressure on you, you cannot do a great job because
Mhm.
your brain is fried.
Yeah.
So you go back and look at your cases and go, why'd I do that? Like, what was I thinking on that day? But then you get corporate involved, and corporate puts pressure on you too. So, so yes, the chat's blowing up on
Yeah,
this.
but you know, on the
On
other
the,
hand, you know, one of the reasons why food had, I mean, the veterinary field had to increase prices is to finally pay the technicians, because technicians were barely make, you know, were making
right.
just a little bit above minimum wage, but you can't live off of that, and they work hard. You
Yeah.
know, they work really hard. And so, you know, it was time. It was not, you know, the level that we were at with pricing for in the veterinary field was not sustainable. It was way too low. Because if you look at the medical field, you know, humans, they are much more, you know, where they need to be. But, you know, because people tend to have insurance, they don't see how much it costs. Whereas with the animals, there, you know, many people still don't have insurance for their animals, and so then, you know, they get a rude awakening. But you can't expect prices to be staying the same with having more expensive equipment, more training. I mean, as veterinarians, we continue to go through training over, you know, at least I do, and a lot of the colleagues that I know, there's always more training, and
It's required, right?
somebody has to pay for it, you know.
Yeah.
Because we have to live too. We can't just dish out money and you know, not get anything back. And it's also an energetic thing, you know. We, as veterinarians, I mean, I go to sleep, I think about my patients. I wake up in the middle of the night thinking about my patients. I wake up in the morning trying to meditate, I think about my patients. So it's like we're constantly on as well. So you know, there's a lot that goes into this, and you know.
That's why I'm not a vet.
Mm.
Because I
Well,
didn't think I had the mental fortitude for it.
yeah. And you know, I'm not crying, I'm not complaining here. I'm not complaining, but there's got to be like an energy exchange, you know. If as a person you give a lot and you don't get much back, you're just going to get exhausted, because that's not how it works on this planet. Energy in, energy out, you know. So
Yeah.
it has to be a give and take. And um I think there's a lot of chaos going on in this world, a lot of readjusting, and unfortunately, there's a lot of pain that's coming out of that as a result too. But you know, the other thing too, when I first came to this country, I was appalled and surprised and like, oh my God, how much money people spend here on things they don't need. Or,
Yeah.
you know, they just think that, and maybe that's a cultural thing, but that's something too, you know. It's like we have to live by the means that we have and not overspend. Like there's so much debt here. In Switzerland, nobody has debt. Well, I mean, they buy a house, you have debt, obviously, because you have to pay mortgage. But I mean, Very
Yeah.
few people, at least when I was there and grew up, had that.
Isn't that
It was
interesting?
not a thing, you know, it just wasn't a thing.
So one of the things that's frustrating here about the US is a lot of corporations are coming in and buying the veterinary clinics, and then they're jacking up the prices and profiting at great expenses, while the doctors, the technicians, the staff, they're still getting paid pennies to the dollar that they're charging. So all of us consumers, pet parents, that's where our frustration comes in, and where the thing about, in it for the money, it's actually the corporations, it's not the doctors, and that's where it gets
But
super
have you
frustrating.
looked at the books of these corporations? Have you had insight? Because I haven't,
No.
so I don't know if that's the case. I don't know if they're actually making that much money. I don't know.
I
They're
personally
Because they're
haven't, but I
paying,
know people have.
they're following the medical model.
Mhm.
And that medical model right now is an absolute disaster.
Yeah.
The heads of the organizations make millions of dollars, sometimes hundreds of millions of dollars. And they come in, they did it to a couple of hospital systems that I worked in. They come in, they strip everything down to bare bones, and then they sell them off for a good price. And then that next organization has to increase everything back up again so it's a quality place. And the person who walks away with all the money is the CEO. And now they're getting called on it,
Mhm.
which is
And the
really
salaries are published, so we have
Yeah.
documented evidence that
Yeah.
this is really what's going on.
Yeah, there was one big organization out here, and that they're going after that CEO because he completely destroyed a couple of hospitals around here, and some patients got hurt. And he's walked away with millions of dollars. He's on a yacht somewhere around, sailing around the world, and they went after him, and they're not going to let go until, I mean, the systems have to change. We keep
Well, and I
saying
think,
the
you
systems have to
guys, adversity is a great opportunity to highlight the change that's needed.
change.
So I think that's where we're going. And I really think 2026 is all about that. Like the veil is coming off of these scandalous things. So it's a little overwhelming because it challenges your reality, because you think that you can trust some people and then you realize that they've been undermining and selfish.
Mhm.
So, yeah. You guys, this has been a bronc ride.
Yeah.
Peter did write that he wishes he had gone to vet school, but he also feels like he would have lost his license. And here's to you, Peter. I think you would have too. So, those Margot Roman lovers, they're pioneers and challenge the norm, and we love you for that. Absolutely.
Yeah. Yeah. Definitely a lot of change happening. So
Yeah, it's
all
exciting
good.
time.
I know
Yeah,
it is.
it
I'm like, I'm not dying yet. I'm gonna stay here. I gotta see what's gonna happen here. It's like like a interesting movie.
it is. It's unraveling and it's
Um,
reality, and we're part of it.
yeah.
So you guys, we can be part of the change. We can be the ones bringing up words like Plechner to clients and friends and vets, and get them to at least be interested in it, which starting the combo and planting the seed on root cause malfunction is where we need to start. So if nothing's working, go deeper.
Yes, exactly. Well,
Right on. Thank you for your time
yeah.
tonight. This was
Yeah, thank you
fun.
all for being here and the conversation. Yeah, it was fun. Thanks, Poppy, for
Yeah.
Thank you.
inviting me to be with your people as well.
Oh, it's always an honor, Odette. Come anytime. You're always welcome. We love
Oh,
you.
thank you. Yeah,
Yeah,
love you guys
absolutely.
too.
Maybe we'll go dancing one day.
Yeah, that'd be fun.
It would be.
Yeah,
So,
for sure.
wherever you land, let me know if you're going to any major conferences or anything like that. Are you
Yeah,
guest
probably
speaking?
Super Zoo would probably be one of the next ones.
Oh, girl.
Are you going to Super Zoo?
I don't know. It's so overstimulating. I'm
Yeah.
like Vegas,
I
no
just
Vegas.
I just go to hang out with people. I don't
Yeah.
really go for the conference or the whatever.
Okay. If
Yeah,
that's
I
the
just
case,
go to hang
Vegas
out
is
with
not
people.
that. Vegas is a cheap flight from Sacramento.
There you go.
Yeah, let's go play in Vegas.
Yeah,
Woo-woo.
yeah.
We may go this year.
Good. You should, actually. It's a good place for you
I'm
guys.
trying to figure everything out, because I can't leave Gigi alone. She has too many meds between her eyes and everything else. So I may get a camper van and just kind of do the tour and then end up in San Diego for the 2 events.
Super Zoo's in August, though,
Right,
right? It's
right.
during the hottest time of Vegas ever.
Yeah,
It's like
I know. We'll be
120
staying in a hotel
degrees.
van. Thank you. We're just going to travel in the van.
Vegas is like a nuclear site. Yeah,
It's hot in the summer. I've done shows there before. Oh my God.
it's crazy.
Mhm.
Super Zoo is a zoo. They named it appropriately.
Probably.
Be blessed. You guys have a wonderful week. I think
Yeah.
iridology practice class is next week. I do believe I'm going to go over the dissection, the irises with the dissection findings. Super fascinating, and not your, like, some of the marks were slightly off. So I just wanted to share that with you guys.
Did you do Gigi's eyes again?
Thank
Odette,
you.
Poppy's doing Gigi's eyes. We've done them.
Oh.
We did them about a year or
Like
two ago. We did
3
them
years
together.
ago, girl.
No, it was when you first started it. I say 2 years ago, but I sent her just when the Plechner got diagnosed. I sent it to her again, and then we're going to follow it.
Yeah, because we're seeing in most dogs and cats your common metabolic markers. So your adrenal, your pancreas, your thyroid, your pituitary are marking. So now I started this combo with my clinical class of we need to talk about Plechner more. And so this is why I reached out to you. Because you're the queen.
But see, it's hard with Gigi's eyes because of all, the detached lens and the ulcer and the cataracts, but Poppy's going to do it.
Yeah, you can totally assess your dog's eyes. The irises are okay. Yeah.
Yeah.
Guys, bye.
Good. Yeah. All right. Thank you. Bye,
Thank you.
everyone.
Thank you.
Have a
Bye.
good
See you
evening.
Wednesday.
Bye.
Bye.
Yeah,
Thank
bye.
you. Bye.